Hey, good afternoon, Anne. I'm here to hand over the patients in the ER.
Good afternoon, Song. Please go ahead with the handover. I'm ready to write down.
Alright, let's get started. In room number 1, we have Mr. Anderson, a 45-year-old male who presented with chest pain. His initial ECG showed signs of ST elevation, and we activated the cardiac team. He's currently receiving oxygen therapy at 2 liters per minute via nasal cannula, and we started an IV line for medication administration.
Thank you for the update. Any changes in Mr. Anderson's condition?
Yes, he received some lingual nitroglycerin, and his chest pain has subsided. However, his blood pressure dropped to 90 to 60, and we administered a 250 milliliters normal saline bolus. He's now stable with a blood pressure of 110 to 70.
I'll continue to monitor his blood pressure and watch for any signs of recurrent chest pain. How about the other patients?
In room number 2, we have Mrs. Ramirez, a 65-year-old female with shortness of breath and a history of COPD exacerbation. She's on high-flow nasal cannula with FiO2 at 50%, and her oxygen saturations have improved to 92%.
I'll ensure Mrs. Ramirez remains on the high-flow nasal cannula and monitor her oxygen saturations closely. What about the patient in room 3?
In room number 3, we have a pediatric patient, 6-year-old Timmy, who presented with a deep laceration on his forearm. We cleaned and sutured the wound, and he received a tetanus shot since he was not up to date with his immunizations.
I'll check Timmy's wound and make sure he's comfortable. Did you notify his parents about the tetanus shot?
Yes, his parents are aware and will follow up with their pediatrician for further care. Also, in room number 4, we have Mrs. Lee, a 28-year-old female with a sprained ankle. She is waiting for an x-ray to rule out any fractures.
I'll prioritize the x-ray for Mrs. Lee and assist her with pain management. Is there anything else I should know about the other patients?
There's a 30-year-old male in room number 5 with a head injury following a car accident. He's currently undergoing a CT scan, and we have started an IV line for fluid resuscitation.
I'll stay updated on the CT scan results and monitor his neurologic status closely. Thank you for the handover, Song.
You're welcome. Please let me know if something happens while I'm at home. It's okay to bother me.
Thank you, Song. I appreciate your warm-hearted mind. Have a great day, and I'll do my best not to bother you.